Hey everybody, this is a lumbar traction video. All right, is it good? Okay. So we're gonna go through some of the components first, and then we're gonna put a real live person on here. This will be your thoracic or your chest brace, okay? The hooks for the table. This will be the lumbar brace that's gonna help do the pulling, all right? This is the kill switch. This is what the patient will hold on to when they're unattended during the therapy session on traction. This is the rope. This is what will be doing all of the pulling. Okay, so we're going to demonstrate lumbar traction. We're going to hook the patient up, and then we're going to run through a few cycles. This is a separating table. So on the side, there's a knob that allows the table to separate and pull apart. You're going to want the patient's hips to be aligned right at that separation, because with lumbar traction, what happens is once you start the pull, you unlock the table, it allows for a little bit of separation. So we're going to want the patient's hips to be right here. All right, everything's in a line, and we're going to bring our subject over to the table. Kendra, so you're going to have your patient lie with the top of their hips right here about this crack. All right, and if you can see, she's a little bit high, so what I'm going to have her do is bridge if she can. I'm going to slide this belt up. Good. Now I want you to scoot your hips down. Keep going. Right about there. Right about there. So you can see the table separation is here. This one right here. The top of her iliac crest is about right there. Okay? We're going to slide this belt up just a little bit more. Right about there. Okay. Now the chest strap. Lift your head and your upper body. This is going to secure right here in her mid-thoracic area. For ladies with large breasts, we want to go under. Okay, lift your arm up. You can see this strap pulls over. This handle allows you to pull tight and down. Bring the other strap up and over, and it should feel like a very tight bear hug. How's that feel?
It's tight.
Can you breathe?
Yes.
Okay. Put your arms at your side, please. Okay. This strap here is going to be securing her to the table. Okay. We're going to take the buckles, snap them together. Now, if you look under the table here, there's a couple of hooks. Okay. Hook her to the table. Pull this nice and tight. So what this part does is secures her upper body to the table so it doesn't move. And then as it pulls, it helps secure her from moving. So this abdominal belt, same thing. Pull nice and tight here. Pull nice and tight here. How does that feel?
Good.
Is it tight?
Yeah.
And can you breathe?
Yeah.
So with this model, it's got a little belt buckle. Okay. Secure and snug it down. Okay, so this ring, once you want this ring right here to be right in the center, kind of midline, all the way down. All right. Next, we're going to, stay right there, put her legs up on this footstool. Okay, so you're going to have your patient lift their legs up if they're able to. If they're not able to, you're going to have to help them. Okay, you can see this is pretty tall for her, right? So there's a little knob here. We'll lower this down. Ideally, you want the patient to just be comfortable. Most patients will be coming in with a lot of back pain or discomfort. So we're looking for a nice position of comfort here. Does that feel comfortable, Kendra? Mm-hmm. All right. So this strap needs to be able to pull pretty straight like this. All right. The strap comes under, through, hooks to the belt. Okay. Now, a couple of different things can happen here. You need to back up just a little bit. First, you can hook the rope directly to this, and when the lumbar traction starts, it gives a pull just like this. However, we usually will use a spreader bar. Hold on. You may choose to use a spreader bar. This model does not allow for that, okay? Some belt models allow for the spreader bar, others do not. But it's possible that you would have a belt that would have 2 hooks on it, where you would have it pull on the spreader bar like this. Okay, so next up, we've got a little bit of slack in the rope. What we want to do is release the slack. Okay, just so there's no slack here. Patient's comfortable, right? She has the kill switch in hand. Okay.
Kill switch.
She can have a pillow for her head if she wants one. Now we're going to set it up. And I think for this first one, we're going to go ahead, and I already kind of have it set up. We're going to do a hold time of 15 and 15, which is for joint distraction, okay? So for this model of machine, it's touchscreen, so I can increase or decrease my time depending on how much I want. So if I want her to be on this for 20 minutes, I'm going to want to set my time for about 5 minutes extra, only because it ramps up, then it levels off, and then it ramps down. So we've got it set for 25 minutes. All right, 25. All right, we're going to do a cycle where it's going to progressively go up and then stay and then progressively come down. Intermittent. Okay. Max level of pounds of pull, right? So for this, we're doing 50% of her body weight. She's indicated to me what her body weight is. This is for joint distraction. So we're going to do 50% of her body weight, which is about that much. Minimum level, that can be maximum level of pull. Minimum level of pull, I like to just kind of cut that top number in half. So we'll do around 47, okay? So the maximum level of pull at maximum here will be the 95 pounds, right? The minimum level of pull will be the 48 pounds. It's going to ramp up and then ramp down slowly. It's not going to pull at the maximum level right away. The hold time for this, 15 on, 15 off. You can easily change it by touching the screen and changing the numbers. Okay, so if we're ready to go, we hit start. All right, we're doing lumbar, beginning traction. Make sure the table is unlocked. This is where we unlock the table. It's unlocked. Okay, now you can see the rope is starting to pull. And you can see here the traction meter is telling us what the amount of pounds of force it's pulling. Okay, you can hear things moving over here. How's the patient feel?
Fine.
Can you feel some pull?
Mm-hmm.
Where do you feel the pull at?
Down here.
Down in your lower back. Okay, good. All right, so it's working. You can see. Holding. Now it's getting ready. It's going to ramp back up and it's going to pull to about, it looks like about 60 to 65 pounds next. If you look right here, you can see how the table has separated. How's it feel?
Mm-hmm.
Is it too much?
Mm-mm.
No? Okay. Does it hurt?
Mm-mm.
Okay. Does it feel good?
Yes.
Can you feel it pulling down a little bit more on your hips here?
Yeah.
Okay. If at any time the patient becomes uncomfortable, she just hits the red button and it stops the machine. It stops pulling. Okay. Now it's going back down. It's running here. Now the next pull should be all the way up to that 95 pounds. Now with this machine, you can really set this to ramp up over a certain amount of time and ramp down over a certain amount of time. I have it set for 3 steps to maximum just to get the point across, but you can set it to 5 steps to maximum or 10 steps to maximum, depending on your patient and depending on what your needs are. You can see the table continues to separate. It's pulling. You can see that the bars are pulling, the straps are pulling. How's it feel?
Yep. I feel the stretch.
Do you feel like 95 pounds?
Yep.
What do you feel? Where do you feel a stretch at?
Right
Low
in
back?
right in my hips.
Right in your hips. Do you feel like your
Maybe
back?
sciatic area too.
Okay. You feel your back stretching?
Mm-hmm.
All right. So this one is for joint distraction. So this is probably one of the most powerful pulls, the joint distraction one.
Mm-hmm.
Do you feel like things are you comfortable or not?
Yeah.
Okay. So this is holding, holding, holding. It's going to give her one more good pull before it starts to ramp down. And that is lumbar traction. How's it feel?
Same.
Okay. All right. So what we'll do is I want you to film that, Adam. Now Kendra, I want you to hit the red button. Okay, the switch has been pressed. The treatment has been terminated. Touch anywhere to continue. Touch the screen. You can see the traction goes straight down. The treatment has stopped. It will ease off all the pressure. Take all the tension off of this. Okay, we'll hit the rope release. Pull. Release the rope, unhook the patient, make sure she's doing okay. So the rope can hang. Now before the patient does anything, you're going to want to take her legs down and get that table back together so you're not pinching her back in the table. And that is lumbar traction.